Almost half of Cambodia's population lives off of $2 a day, and 2/3 of its population is under 30. But Cambodia is more than just numbers. It's a place of history, development, and hope. My name is Anita McBride, and I am on the faculty at American University School of Public Affairs. As the former Chief of Staff for First Lady Laura Bush, I traveled to more than 60 countries to see the implementation of U.S. development programs. Recently, I had the opportunity to travel with a bipartisan group of policymakers from the U.S. and Australia, thanks to the poverty-fighting organization CARE. We went to some of the poorest areas of Cambodia to learn how U.S. and Australian investments in health are working in collaboration to save lives and empower communities. The members of Congress included Representative Kay Granger from Texas, Representative Andrew Crenshaw of Florida, and Representative Mike Quigley of Illinois. We were joined by two members of Parliament from Australia, Andrew Giles and Tim Watts. The U.S. government is the largest single donor in maternal and neonatal health in Cambodia, spending approximately $14 million each year. We have leveraged these investments by coordinating our resources effectively and partnering with other governments, nonprofits, and corporations. In Phnom Penh, our trip started with a visit to garment workers. More than 90% of garment workers in Cambodia are women. We learned how CARE's Peer Education Project has provided education on maternal, newborn, and child health, including how to plan and space births. We also met with high-level members of the Cambodian government, including the Minister of Women's Affairs. The Cambodian government has been instrumental in reducing maternal and child mortality. Next, we traveled outside of the capital of Phnom Penh. In the rural parts of the country, CARE has programs linking women and children to better health outcomes. One innovative program utilizes CARE's signature micro savings program, known as the Village Savings and Loan Association. The program helps women build their own successful small businesses and invest the profits in their health needs. Another program trains and mobilizes community health workers to reach a greater number of mothers with health education information on hygiene, nutrition, and reproductive health. Next, we visited a successful integrative health clinic with trained medical professionals that provide comprehensive health services to women and their families in 550 health centers and 9 provinces across Cambodia. Our journey ended with a lunch with U.S. Peace Corps volunteers, one of the best examples of our nation's generosity. They are working to improve health systems and poverty conditions in Cambodia. From this trip, our group walked away encouraged about the future of Cambodia, and with the help of a strong local economy and international development, the women of urban and rural Cambodia have access to better maternal, newborn, and child health care services, giving hope of a better life to women and their families